Have you ever wondered why certain athletes are more predisposed to developing ACL or anterior cruciate ligament injuries in their knee? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. And in this video, we're going to be talking about why ACL injuries happen more often in certain people. So there are various reasons for this. Remember, the ACL is a ligament. A ligament connects two bones, and the ACL connects the thigh bone or the femur to the leg bone or the tibia in the knee, right? So it prevents the knee from going excessively forward and rotating. So how does it break? Common ways of it breaking are pivoting injuries, that is sudden twisting of the knee. So it's like your foot getting stuck on the ground and your whole body rotating around it, which is common in football, basketball. Or it could be because of hyperextension. Hyperextension is the knee goes straighter than usual, so the ACL snaps. This happens when either in gymnastics or even in football, when the leg is planted, the body goes forward and it excessively pushes the knee backward, which can snap the ACL and cause an injury. Now, when you have an injury, the first thing that happens is pain, swelling, immobility. That means you can't put that foot down and walk. And instability, that is when you put it down, you feel like your knee will twist. Now, how does it happen in certain people more often than the others? So it happens in people whose thigh muscles, and that's the quadriceps, and the hip muscles, the hip abductors and external rotators are weak. So if you're just playing sport and not exercising these muscles, fatigue will set in early. As a consequence, your form will not be all right. As a consequence, the load on your knees will be more. As a consequence, injuries can happen more often than not. Now, injuries can be non-contact or contact injuries. So what are non-contact injuries? That's typically what I explained to you right now. Contact is when somebody bangs into the leg. You're playing football, the defender comes with his leg, hits the knee and it twists. The contact injuries are something you can't really prevent other than getting the right footwear, learning the sport properly and being careful when you're playing on the right surface, etc. But non-contact injuries, certain people are more predisposed to it. Like female athletes. Why are female athletes more prone to it? Couple of reasons. One is the hormonal changes have been known to affect it, especially during the menstrual cycle. There are certain phases where the ligaments and the muscles are a little more lax and they're more predisposed to injuries. Women have smaller notches in the femur where the ACL is put, so smaller real estate means the force on the ACL is more, chances of injury are more. People with ligamentous laxity, those are people who are excessively flexible. Such people are actually very good at sport because see, I have pain, so I can't take my thumb backwards. But somebody who's very lax and flexible will be able to take his finger all the way to his forearm and he has no pain. So pain is my protective mechanism. It's not that my joint can't go all the way there, but pain protects me. But in people with ligamentous laxity, there's no pain. The onset of pain and onset of injury is very close to each other, hence injuries happen more often than not in them. So to prevent it, it's very important to learn your sport properly, play on the right surface, wear the right footwear, play with the right people, and work on your muscles other than just the sport alone. Now, when such a thing happens to somebody, it's important to give him emergency care there with rest, ice, compression and elevation. Compression can be with a crepe bandage or a knee brace. Elevation, ice helps, and get him to the nearest doctor to be evaluated. And most importantly, don't play the sport for some time till the time you have recovered. So how is the ACL tear treated? So depending on what kind of a person you are you a sporty person, active person, depending on your age and activity level. If you're relatively older, 50s, 60s, not much into sport, very sedentary life, you may need nothing if only the ACL is torn other than physical therapy and exercise. However, if you're younger and you want to get back to playing and lead an active lifestyle, I always tell somebody a dog can run behind you, you should have the ability to run away from it. Then surgery is the solution. Surgery involves either repairing the ACL, that's stitching the ACL back, or reconstructing it. Reconstructing it could be using an autograft, an allograft, or a synthetic, an artificial ligament, which is the latest and very popular these days. Very successful operation, very successful outcome, but it is a combination of physiotherapy and the surgery that gets you back to the ground to play. How fast do you get back? In an artificial ligament in about 3 months, in an autograft 6 months, but pivoting sports like football and basketball in about 9 months. I hope you enjoyed this video. I hope you got a lot of information as to why ACL injuries happen more often in certain people. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a very popular silver play button Hindi channel. Please like, subscribe and follow it. Thank you.